The world of baby emotions is more than meets the eye. Babies are amazing little beings, capable of much more than we often realize. Their emotions are rich and complex from a very young age. Understanding these emotions is crucial for caregivers. Babies have been misunderstood as driven solely by basic needs. This couldn't be further from the truth. Babies experience a wide range of emotions just like adults. Recognizing these emotions is fundamental to their well-being. By understanding baby emotions, we create a secure environment. When babies feel seen and understood, they develop trust and security. Recognizing baby emotions builds strong, loving bonds. It helps us connect with them on a deeper level. Unmasking baby feelings involves busting myths with science. One of the most persistent myths surrounding babies is that they are incapable of experiencing complex emotions. This misconception often stems from the belief that babies' brains are not yet developed enough to process emotions in the same way that adult brains do. However, scientific evidence paints a very different picture. While babies' brains are still developing, research shows that the areas responsible for processing emotions are active from birth. In fact, studies have shown that babies as young as a few days old can distinguish between different facial expressions of emotion, such as happiness, sadness, and anger. Furthermore, babies are highly attuned to the emotional states of their caregivers. They can pick up on subtle cues like tone of voice, facial expressions, and body language, and they respond accordingly. This sensitivity to their social and emotional environment further underscores the fact that babies are capable of experiencing and processing complex emotions. The idea that babies don't have true emotional experiences is simply not supported by scientific evidence. It's time to put this myth to rest and embrace the reality that babies are emotional beings from the very beginning. Decoding baby talk involves understanding how infants express their emotions. While babies may not have the words to tell us how they're feeling, they have their own unique ways of communicating their emotions. As caregivers, it's our job to learn to decode these signals and respond accordingly. One of the most obvious ways babies communicate their emotions is through crying. While crying is often associated with hunger or discomfort, it can also be a sign of other emotions such as fear, frustration, or overstimulation. By paying attention to the different types of cries as well as other cues like body language and facial expressions, we can begin to understand what our babies are trying to tell us. In addition to crying, babies use a variety of other nonverbal cues to express their emotions. For example, a happy baby might smile, coo, or wave their arms and legs excitedly. A sad or distressed baby, on the other hand, might frown, whimper, or cling to their caregiver. As babies get older, they develop even more sophisticated ways of expressing their emotions. They might start to point at things they want, shake their head to indicate no, or even try to comfort others who seem upset. By tuning into these subtle cues, we can foster a deeper understanding of our baby's inner worlds. Nurturing Tiny Hearts is a caregiver's guide to emotional growth. Caregivers play a pivotal role in shaping a baby's emotional development. Responding to their emotions teaches them about the world and helps develop their sense of self. Sensitivity and empathy create a secure base for exploration and emotional intelligence. Providing safety and security is crucial for emotional growth. Create a nurturing environment where they feel loved unconditionally. Respond to their needs consistently and promptly. Help them learn to regulate their emotions. Teach healthy ways to cope with difficult emotions. Model calm behavior, and provide opportunities to express emotions. Every interaction is a chance to nurture emotional growth and build a loving bond.